Okay. Yes, I can see that attendees now.
Great. Welcome everybody who's joining us.
Yeah.
Welcome Anne. I see Fred, Kevin. Welcome Angela. Welcome Arlie.
Okay, I gotta go.
Elizabeth, Ines.
I guess I will wait. Yeah, we'll wait just for a minute
Welcome Morgan.
for the people to come in.
Welcome Yvonne, Viveka. Welcome Ruth. Wonderful to have you all with us.
Yeah, so I guess we can start now. Do you hear me very well? Okay. Okay. So hi everyone. I'm Hal Ali, the coordinator for Easter Alliance for Global Health Partnership and Easter Ireland. So before we start, I just want to let you know that this webinar will be recorded and we will post it later on our websites, www.globalhealth.ie and www.easter.eu, and also in our social media channel. Live streaming is also available on our Facebook page, Irish Global Health Network. So before I introduce my co-host and the speakers, let me give you a quick orientation on how to use Zoom webinar. It's a bit similar to the normal Zoom, but with your experience as an attendee, your video and audio are disabled at this time. But if you have any questions, you can raise your hand and we will be back to you later when we open the floor for the questions. Otherwise, you can use the questions and answer feature in the bottom of the screen. You will find an icon of it. So according to your preference as well, you can choose how you would like to see the videos of the panelists. There is a feature in the top right of the screen, so you can choose either the gallery view or the speaker-only view in case you prefer to see one speaker at the time. Now, let me welcome everyone to the launch of Conversations on COVID-19 webinar series. It's a place for personnel working in global health and healthcare, where we exchange information and ideas with the experts in the field. This is the first webinar in the series, and we will continue to produce one webinar weekly on Fridays at 1 p.m. GMT. Each week, we will host 2 or 3 experts to talk about relevant COVID-19 pandemic topics, discuss certain aspects related to your work within the context of COVID-19, answer some of your urgent questions, and hopefully help you gain some certainty in this ambiguous time. As these webinars aim to assist you and help you out, we encourage you to suggest the topics that you would like to discuss and send us your pressing questions. And we will try our best to come up with the answers either on the coming webinars or on our webpage. Now, I will hand over to my co-host, Nadine Ferris-France, the Operation Director of Irish Global Health Network, who will then introduce the speakers and lead the panel discussion. Hi, Nadine.
Great, thank you, Hala. Hi, everybody. Good afternoon. Lovely to see so many of you with us. At the moment, we're at 53 participants, so you're all welcome, and it's still rising. So welcome, welcome. And as we go through, please do ask questions in the question and answer function in the bottom of the screen. So we're delighted to be able to contribute in some way at this really unusual time. So today we have with us 3 wonderful speakers. Many of you will know them very well. We have Ruairi Brugha, who himself is a medical doctor, a public health specialist, and also Professor Emeritu and former head of the Department of Public Health and Epidemiology at the Royal College of Surgeons. Ruairi, thank you for agreeing to jump into this with us today. And Ruairi is going to talk to us a little bit. He's going to give us an overview of the current European response to COVID and just a little bit looking at the long-term outlook. So thank you for that, Ruairi. We have Diarmuid McClean. Wonderful that you could join us, Diarmuid. Diarmuid is in Malawi at the moment. He's the Deputy Head of Mission in Irish Aid in Longwy. And Diarmuid is just going to give us just a glimpse of the current situation in Malawi in terms of preparedness and in terms of the challenges. And, you know, we hope to facilitate a little bit of what has been learned from the Irish experience so far, even though it's very It's very new and still emerging day by day. So Dermot, thank you for being with us. It looks very warm where you are, warmer than here. And Niall Roach, delighted Niall could be with us. Niall is a lecturer. He's also a board member of the Irish Global Health Network, an environmental health officer by background, and Niall runs a public health module on the Masters in Humanitarian Action in UCD. And Niall is going to help us with his expertise, just look at various aspects around water, health and sanitation. He's been talking about this for many years, and suddenly all of us are now talking about it. So we're going to, ask Niall to look a little bit around the relevance of his experience for Ireland, but also for partner countries. So let's kick off, if we can. Ruairi, we might come to you, and just to kind of set a context for us in terms of, can you give us just an overview of what do we know so far around transmission, and what have we learned from other countries so far? Kind of over to you, Ruairi.
Thank you, Nadine. I think to try and simplify it for myself and hopefully for others, I think we're really looking at three broad types of epidemic globally at the moment. What we have seen in Southeast Asia, in China, Singapore, Hong Kong, Korea, is effective suppression. We've seen the large peak of the epidemic being interrupted, and we've seen this reduction to actually eliminate cases. Hala, you might actually just put up a slide there now.
Okay.
So what we're seeing in Europe is countries attempting to suppress the epidemic, but in practice not achieving the degree of suppression that was possible to achieve in China. Those of us in Ireland will have seen this slide, which is from the government, which shows what the objective here is, which is to dampen the epidemic so that the cases are spread out over time. We see this horizontal line, a serrated line there, which represents the capacity of the healthcare system to cope with the epidemic, particularly intensive care beds, respirators, flattening it out over time so as to not allow the epidemic to overwhelm the health services. I think the third epidemic that we're going to see, and I think this is the one we should focus on, and I know Diarmuid will be able to speak to it a bit, is what are we going to see in low resource settings that cannot bring this set of interventions, we won't be able to resource them and achieve the population coverage. If you go to the second slide there, we'll see what the interventions are, and most of us are pretty familiar with them. They're at the individual level: case isolation in the home, which involves detecting the virus, contact tracing, and voluntary home quarantining of all household members. And we're seeing three sets of population interventions: social distancing of the whole population, focus on the under 70-year-olds, or closure of schools, universities. And in terms of how long this is going to last, really we're looking down the road. I think that if there is a message here, it's we are in for the long haul. We've been hearing references to weeks and now months, and then perhaps many months. I think we're looking right into 2021, because as if we are successful, as China has been, it does mean that the population is still vulnerable to infection. If you turn to the next slide, we'll just see what are the package, the component of the intervention. And these are the non-pharmaceutical interventions. If you look at the very top curve there, the black one, thank you, that's if we do nothing at all. And in the context of Ireland, Europe, North America, we will see a need for intensive care, which is 30 times greater than the available intensive care, which is there at the moment. But by introducing these interventions, case isolation, and as you go down, we're packaging more and more interventions together. Even if you see the bottom one there, case isolation, home quarantine, social distancing. This is what they aimed for in the UK. And what they realized after having sort of aimed for that was that they were still going to have an 8-fold greater number of patients requiring intensive care than they would be able to deal with. And they are now moving over to where Ireland is doing and what other European countries is doing, which is to try and achieve the suppression that China did, but in a very different social context. Maybe the final slide there, and I think this is just to maybe set the frame for this particular webinar, because I think as we move to Diarmuid, I think we could start to think about, we've heard so much about what we need to do in Ireland, but what is feasible in resource-poor settings? Now, this is purely my opinion. It isn't based on what I've been reading, but I do believe we're going to see high levels of mortality among the elderly in just a few months period in some of the poorest countries. We need to be considering what's going to be the impact on programs, food programs. What's going to be the secondary effects of the epidemic, which is it's going to undermine existing health services and staff. And I do know from my my contacts with foreign affairs, talking with some people in NGOs, there's a particular concern about how do we protect and support staff, what are organizations or duties of care, and what sort of support can we be giving to governments and beneficiaries. So let me stop there. I've been talking a long time, Nadine.
That's great, Ruairi. Thank you so much. And I think we'd like to hear more. We'd like to come back to some of those points as well, but just to kind of get everybody involved in the conversation, and just to remind everybody who's here as an attendee that there is a question and answer on the bottom. And if you have any specific questions, please pop them in there and we'll do our best to respond to them. So just moving over to Diarmuid, so a very different context. Diarmuid, you know, you're sitting in Malawi at the moment, and obviously just kind of all of you really trying to think about what's to come rather than what's actually there. So can you give us just an overview of, you know, what is the current situation in Malawi, and, you know, what's happening in terms of preparedness, or you know, how is it right now?
Yeah, thanks a lot. And this is a fantastic arrangement. I guess we're all going to, out of every crisis, come some benefit. And I think this kind of virtual discussions and virtual meetings, we're going to get better at these things if the internet works. So let's hope. And all right. But in the Malawi setting, just to say that, look, there's no case yet. Okay? So we're all fine. Everybody's happy. No, of course not. And I guess, you know, the big difficulty in this situation is that there's a few cases in surrounding areas. It's very much a Chinese, European sort of issue. It's been difficult to get political support for this. And I think what's really needed here is not just leadership, but we need presidential leadership, because the kinds of measures that need to be applied, the kinds of stuff that Ruairi was speaking about, and in this sitting, the timing at which you apply these measures. So you're kind of saying you've got to come across as if you're overreacting to the situation, which at the moment is no cases. Is that the truth? That is definitely not the truth. And we should be overreacting. And that requires, these are big, bold political actions, and they cannot come from a minister of health or a minister of education. It has to come from a president. And we're seeing it slowly happening, and we hope that appear in Zambia. It's happened in Zimbabwe. South Africa is also sort of waking up to this whole thing. And maybe that will come across here, but that's the first thing. Yeah. It's the presidential leadership that's needed for us to begin to perhaps get a little bit ahead of this virus. And the second issue, I think, is that in this setting, we shouldn't be, I guess, lulled into a sense of assurance because we've got good medical people, good Ministry of Health people, good NGOs and UN agencies around here. That's not going to cut the mustard here. It really has to enter into the political arena. And in general, health guys are not big political hitters. And I guess related to that, and I'm bringing these two issues up because they are playing out here, is that it also matters a lot where you are in the political cycle. So, for example, in Malawi, this is a year post-elections. The election was contested in court. The court nullifies, first in Africa. No, it's not. It happened in Kenya. And then there's a huge, huge effort happening within political parties, and they are completely and utterly distracted by party politics. And so we're sitting around here saying, guys, you know, there's some real serious stuff happening around here, and it's going to affect every aspect of our lives. So I guess what we're doing is we're moving into what are the alternatives for us? How does the tail wag the dog? So we're beginning to kind of look at what are our options: interfaith leadership, working with journalists, and in many ways leading by example. So we are taking drastic measures in the embassy. We are splitting up into two shifts, initially 2 teams that never meet each other. We are asking our partners, what are you doing about preparedness and contingency? And that's starting to spread. And we're seeing that a lot of organizations, a lot of agencies, all of whom have some influence, are beginning to take on these measures this week. So maybe that'll work, and maybe that'll find its way up into sort of the highest level of political leadership in the country. Then with regard to programming, these are also very interesting things. You know, we're in the aid business here, as well as the political business. And although we're not involved in the health sector in Malawi, we've been able to come to a sensible decision that it doesn't matter if we're in health or not, because whether we're doing agriculture or education or whatever, this epidemic will have a serious effect on all of the results that we are chasing here. So we have already managed to mobilize money that has got nothing to do with its original allocation for health to make a contribution to the national response to COVID, very much around preparedness and the early phases of containment. But what's really important about it is that the quick money is the valuable money.
Right.
And we've sort of been doing the rounds, finding out who's got money, and the World Bank, they've got money. Anyway, I better not name people and organizations, but people are out there saying, yes, we can help. 6 weeks, going to take 2 months, that's far too late. And so the quick money is the real value for money. And so what we're doing is we're saying it's possible to get quick money, and we're going to show you how to do it. And hopefully we can, and really show that this is a useful way to spend money that was destined for other aspects of our work. And then maybe responding directly to some of the issues that Ruairi alluded to, it's really the reality of people's lives here. And the prospect of self-isolation. I think anybody who knows what living conditions are like for most of the people, certainly in urban areas, and there's a lot of people in urban areas here, is the average number of people living in houses, the size of houses, the proximity of houses to each other. Self-isolation is just very, very difficult. And as a measure, I mean, essentially what you're going to say is you're going to confine the infection to those bunch of housing, the COVID virus. And then, of course, obviously the health system, it's at best already stressed. There are very few isolation facilities. These were already put in place for Ebola preparedness. If we get a few cases, that's it, over. And then even if you manage to kind of say, well, it's not about isolation places, but barrier nursing, and do what you can. And even things like oxygen already just without the sort of surge in demand that we are expecting, is not always available, and that would be a nice way to put it.
Yeah.
And oxygen is about as far as you go in a setting like this. Ventilation, that's just not going to happen. So yeah, I think it's going to be difficult to stem this and flatten the curve and delay it, as Ruairi was putting. It's going to be difficult, but it's worth the effort. Once it takes hold, the health system will be overwhelmed, homes will be overwhelmed, and we can expect, significant death rates. Now, we're not too sure what the mortality pattern will look like in a place like Malawi, where 10% of the population is on antiretrovirals. Young people are walking around with parasites and malarias and anemias and micronutrient deficiencies and the like. But let's just say there's a theoretical risk that things could. Yeah, but maybe if I can end up with one question back to Ruairi from a technical perspective. So, for example, in China, they've done pretty well, 2 days, no cases. Can it bounce back?
Well, let's Diarmuid, let's leave it for one second. I mean, I think that's really important, and I think hopefully we get to just discuss that a little bit. But just coming over to Niall, kind of coming back closer to home here, and you're talking about isolation measures and the things that we're doing and not doing and struggling with here in Ireland at the moment. Niall, what do you think in terms of environmental health measures? What do we need to be really vigilant about during this containment phase? What have you seen yourself? And you have a lot of experience working on this, and now suddenly here we are in Ireland struggling with these things.
The key thing, well, thanks again everyone for initiating this webinar. I suppose the first thing I'd like to say is that the key thing here in Ireland, what's happening is about behaviour change. I think we talk a lot about doctors and nurses at the front line, and yes, they are the front line. But actually the key to preventing this or to flattening the curve is actual individual, family and community behaviours. And I think what has been really, really important in Ireland has been the way the message has been communicated, who it has been communicated by. Diarmuid mentioned political leadership. I think we have had political leadership in Ireland. We're making decisions early. And I think like what Mike Ryan was saying in the WHO, don't be afraid to fail, just act, and act with speed. And be proactive and not reactive. And I think that's one of the things I think that has been highlighted to me in Ireland, is how I'm impressed with the health system and the HSE in terms of how we are responding quickly. We may not achieve the levels of suppression that we want, but we are acting proactively. And I think that's a very important thing to say. I want to talk about low-income countries as well, but maybe just for some of the stuff in terms of environmental health here in Ireland, I have been quite appalled, and we had a letter published in the Irish Times today, because at the moment, because we have closed down the schools, we have closed down restaurants, we have closed down pubs, so there are very few points or places in our community where people congregate. And the key points for congregation and transmission, infectious disease transmission, is supermarkets and pharmacies and other food stores. And I think we need to be very vigilant in those supermarkets. The guidelines are not terribly strict at the moment. I was in 2 different supermarkets yesterday, chalk and cheese, one very slapdash, hardly anything at all, no information, education and communication messages, no messages over the tannoy, very little messages about the social distance, particularly around checkouts. But the other one then was good. They had sneeze screens over the checkouts. They had clearly demarcated areas on where you stand when you're checking out, keeping your distance from those who are serving you the food, that kind of stuff was there. If I was just quickly to list off some of the stuff that I would like to see here in Ireland in relation to supermarkets, is having controlled entry and exit based upon the floor space that is available within the shop, so you're not overcrowded. Because I think overcrowding is critically important in this, and that brings up other issues around ventilation, which I think is another environmental health issue that perhaps we haven't been thinking enough about in terms of the behaviours that we need to adopt in our own households. Disinfecting trolleys and baskets so we're not in contact with surfaces that have been contaminated. Hand sanitizers, I think, on entry and on exit. I would like to see more or hear more public announcements, posters reminding customers and the staff to maintain their social distance. Even the supermarket I was in yesterday, I saw 3 staff chatting away and they were all right on top of each other, stacking the shelves. They should be maintaining their distance as well. Clear demarcation for social distance at the service counters and the checkouts. Clear cleaning procedures, which I think there should be a focus on critical control points. We talk in hygiene promotion, we talk about hazard analysis, critical control points. And that would be issues around even where you pin in your debit card number. That area should be cleaned after every transaction, I think, and also in the self-service points as well. Baked goods being covered. You can't wash a croissant or a donut or a baguette when you go home. You can wash a bag of potatoes, or you can wash your potatoes, but you can't wash a baguette. Sneeze or cough shields at service points and checkouts. There seems to be some confusion among staff about using gloves, whether it's good to use gloves or not to use gloves. My understanding is that gloves are not very useful, that you should not be wearing gloves. And then some supermarkets are introducing stuff around handling cash and not to be handing notes and coins. These are all kind of practical, kind of detailed procedures I think we need to be seeing in our supermarkets in order to reduce that potentially infectious environment that we all go to. And then, of course, ensuring that older people have a particular time for shopping. Those of us who can, like myself yesterday, I was shopping for my own parents, so they don't even have to go to the shop. Or we have the facility here in Ireland, which maybe Diarmuid doesn't have in Malawi, is to shop online, if you can shop online. That's just,
and I see that shopping online, a lot of the slots are already gone all the way through April at this point. Yeah.
Really? Wow.
That's just at an Ireland level. Now, maybe you want to go back to the other panelists before I talk about get on my wash.
Well, I mean, just while we're with you, Niall, you know, you have a lot of experience. You yourself have worked in Malawi as well. So I just think it's interesting, just, you know, just the contrast. I mean, what are your concerns in relation to water sanitation, and what do people need to be thinking about, for instance, in Malawi? What kind of advice could you give?
Yeah, sure. Well, we look at water, sanitation and hygiene, and I always look at it in a broader context of environmental health and broader kind of public health. And I think it's really, really important for those who are working in WASH are coordinating with the other sectors or other clusters that we work in. So when I was working in UNICEF in Malawi, I had the nutrition cluster right across from me. And Diarmuid mentioned there about the issues about people who are malnourished or suffering from micronutrient deficiencies and what effect does the COVID-19 virus have on those? I don't know, but we need to be connecting with them. The C4D, communication for development section, is another important avenue for communicating health messages. The education section, obviously, also stuff is still going on in schools, and the health sector also as well. So we need to be in coordination because this is a humanitarian emergency. It's not what I'm normally used to responding to. I've never responded to the Ebola crisis, and to some extent cholera. I'm not normally responding to conflict or natural disaster. So I think coordination is key, and particularly around communication and how we communicate messages, who is delivering that communication. Is it a trusted source? Doctors, we know in Ireland, are the most trusted profession in Ireland, and they are the people who are delivering the message. We look at WASH in 3 different kind of domains or spheres. One is WASH in the community. And as I said already, I think in the community, prevention at the community level is the most critical level where we can suppress the curve. But also WASH in healthcare facilities also I think is very, very important, and WASH in schools. And I'm going to discard WASH in schools because I'm going to assume, maybe Diarmuid has knowledge on this in terms of Malawi, whether they're going to close the schools or not, but in Ireland, schools are closed. I think I am worried from a WASH perspective because WASH is a fundamental element of primary healthcare. Yeah. And for years, WASH has not been funded very well, and that is reflected in terms of our coverage in relation to WASH. You know, and within WASH, just the good news, I suppose, is that from the evidence that I have in some of the guidelines, COVID-19 is not transmitted through water or sanitation. So our focus really is around hygiene and hygiene behaviors. And obviously WASH people focus on hand washing, for example, with soap, but there are other behaviors that I'll mention in a minute. But if you look at the data that we have from the joint monitoring program of UNICEF, WHO, nearly 75% of the population in least developed countries lack hand washing facilities with soap and water. So this is a behavior we are promoting, but people are not enabled to wash their hands because they don't physically have the hand washing facilities.
Right.
And we know from some of the data we have that less than 20% of people, this is a global estimate, wash their hands with soap and water after going to the toilet, for example. So we're already starting at a very low base in terms of existing behavior. I mentioned kind of other behaviors that we need to try to promote. And again, communication will be important around that. Social distancing, coughing, sneezing etiquette, avoiding gatherings. And even my own self now on Monday, I'm going to a funeral and it's going to have to be organized in a particular way so that we're not overcrowding. And even issues around ventilation, because I remember doing my master's thesis on TB and nothing in WHO guidance at the time was on the importance of ventilation. Right. To try and remove a virus or to remove a bacterium from it.
Right, and just to let people know who are attending this webinar that on our website we are taking questions, very specific questions. People have all sorts of questions about, you know, how long the virus lives, you know, ventilation, those kind of things, and we have a frequently asked questions document that we're continually updating. So we'll do that based on the questions that come in here as well. I'm just wondering, Ruairi, if I just come back to you and just looking at some of the questions coming in, I mean, in terms of a longer term outlook, I know you mentioned it briefly, but if you could just say something about that. And also I see a question around, you know, what's the chance of having a second wave? That's one, you know, a second wave coming. And then one other would be, you know, how confident are we that the containment measures that are coming in reported by China are as we hear them? And I really appreciate that all of us are learning as we go and that we may not know these answers even as panelists here, and if we don't we can find out. But just, I don't know, Ruairi, whatever you would like to contribute on that.
The more successful we are, the more in danger we are.
Can you unpack that a little bit?
China has been remarkably successful. It's also in a position where it can actually maintain that degree of suppression. It has a huge population of, if it's say 1.3 billion, 1.29 billion are at risk of infection. And because they've been so successful, they know that they could get a massive epidemic if they relax their measures. They are in a position where they can maintain those measures. They have been successful with suppression. They are going to be implementing quarantining. Nobody will be allowed into the country without being quarantined, and this being enforced the way they can do it for 14 days. And they're such a large country that while you know the impact economically on them will be considerable, they can do it. I'm more pessimistic about the ability of more open societies like Ireland and European countries to do it. And we've already seen, you know, lockdowns happening, and people are going to be starting to try and balance up, well, the impact of the lockdown, of the social impact, the economic impact, against well, what is the cost of allowing the epidemic continue? I'm much more pessimistic about the poorest countries. I think sub-Saharan Africa, I just don't think the resources are going to be there to successfully suppress this virus. It's remarkably infectious. Even in China, where it's not probably the program to follow. Maybe others like Taiwan, Hong Kong, Singapore may be better models, I think, where there was much more of an emphasis on testing, as we hear from the Director General of the WHO. But even in China, which was with their draconian measures, they missed 50% of cases. You know, the coronavirus, it can be transmitted, we believe, in the pre-symptomatic phase. We believe there is an asymptomatic transmission, and it's quite a low-level disease that a lot of people miss. And that is why the traditional ways of controlling an epidemic aren't working here. The detection, identifying the case, testing, contact tracing. That's why we have to have all these other measures, which Niall has been talking about there, the extreme social distancing. And I think we are really struggling to do it. I think on a personal level, I feel, we're struggling,
Yes.
as a typical family, a child,
Yes.
elderly parents, parents-in-law. There is a risk that in Europe we might just fall between two stools, that we have this ongoing epidemic. We don't really manage to suppress it effectively, like some of the Asian countries have been managed to do. What we will see in Africa, I believe, is quite high levels of mortality over a short period of time, mainly affecting the elderly, and it'll be a little bit like a storm that'll pass through. But what it will leave is a population of people who actually are immune, or we hope are immune to the virus. So coming back to what Diarmuid was saying there, what is the risk of a rebound? If a whole population becomes infected, and up to 80% of the population will be infected if we don't do anything effectively, they will have a degree of protection. What's the end game? We do need a vaccine. Now, treatments are being developed. If they're found to be effective, we need to target them towards those who are most at risk, the elderly, the vulnerable, get in the antivirals early in the course of the disease to prevent the complications. And you can see huge problems around distribution, around competition for resources, competition for, and this is going to be within countries and between countries, between rich and poor. A vaccine, some very knowledgeable people are saying 18 months to the point where you're really rolling it out. We are in there for the long haul. Some people, I see Adrian Hill in Oxford, there's a very good vaccine group there, believe that actually we could be rolling out at least to some degree before the end of the year. So people are going to have to kind of change their whole perspective on how they live their lives. We're going to have to change our perspective about how we run our economies, and start to think, no, this is not just until the end of the school holidays and we hit the summer and we all come back to normal in the autumn. I will send around one more resource, maybe, which I haven't sent around already. Some people will have read about the Imperial College study. Yes. It's quite an eye-opener. One of the things that they suggest is that we may have to really very intensive with our interventions, to the point where we're suppressing, but at some points along the way we're going to need to relax them, but be vigilant and bring them in again. So we may see, I think, a more targeted approach, an approach which is learning from what's working and what's not working. And we're going to need to be balancing the health of a minority of vulnerable people. We need to think of the human rights dimensions. Right. We need to think of social cohesion. I think these are the things we need to be looking at in Africa, which is particularly protecting what we have achieved so far, protecting the health workers. There's 25%, I think, or 20% of those infected in Ireland have been health workers. And I think development agencies need to be thinking about where they're putting their resources, because it's not only the epidemic and who it directly affects, it's these secondary effects that we really need to be looking out for.
Thanks, Ruairi. And I think, just talking about vulnerable groups, I've been on calls this week where, just looking around social inclusion in Ireland and how can we make sure that our messages are going out to the most vulnerable groups in Ireland, our travellers population, our homeless population, what are the challenges with that? So I think, as we're moving, I think that these issues are the same in many countries, just at different stages. We've lost Diarmuid there for a minute, so maybe Niall, I'll just come back to you until we get Diarmuid back. And just reminding everybody there's a question and answers box, and we'll do our best to answer some of them on the panel, and the rest we will answer on our frequently asked questions document. Go ahead, Niall.
Yeah, just to highlight what Ruairi was just saying there about protecting health workers. Again, I mentioned earlier on about washing the community, but also washing healthcare facilities is also critically important in terms of infection prevention and control. And the 2019 Joint Monitoring Programme report of WHO and UNICEF says that 896 million people use healthcare facilities with no water supply, 1.5 billion use facilities with no sanitation service, and they don't actually give the number of facilities that don't have adequate hand hygiene facilities and safe waste management facilities as well. So I think there's a huge amount of work to be done in healthcare facilities in supporting infection control, infection prevention and control for staff and also for patients. And I think also this is just to highlight, this is like, I think this is a cross-cutting mainstreaming issue, as we might call it in development circles, but it's also a protection issue. You know, we talk a lot in mainstreaming protection in humanitarian emergencies. This is actually a protection issue. Maybe not from sexual exploitation and abuse. I'm sure there's been an element of that as well, probably as well, but this is a protection issue. So all development agencies in Ireland, I know, take protection very seriously. And I think we need to just visualize that protection is a bigger issue. This is a protection issue in terms of protecting staff, all staff, but also the beneficiaries that they work with, no matter what sector they work in, whether it is livelihoods or education or WASH or health or whatever. I think there are a couple of key messages I want to get across.
Yeah, thank you, Niall. Diarmuid, you've come back on there. Can you hear me?
Yeah.
Okay, great. We'll try and get your video back on. But just in the meantime, I mean, there's quite a few questions coming up in the chat box that we can talk about later. You know, questions around, you know, test kits. Are test kits? Are you kind of helping? Are you involved in sourcing of them? Personal protective equipment for healthcare workers. How are you thinking ahead in terms of that? But also just a broader question in terms of, you know, how can we in Ireland support you as you're kind of, you know, as you start to deal with what we've already been dealing with.
With regard to requirements, I think that the country is quite clear. There's a lot of technical input into the phases of inputs and that are required. If the early money is mobilized, it'll be used very well, and it is. And it looks like the stuff is available.
Your internet is freezing on us a little bit, Diarmuid. Which I think it shows one of the challenges that there's going to be for a country like Malawi, where we're able to swap to online and to communicate like this, and clearly that's going to be a big challenge for Malawi. Diarmuid, hopefully we'll get you back. We'll get you back as soon as we can. I'm thinking that it would be good just to, we have 70 people attending this webinar, and thank you for those of you who are putting in questions. And I'm just wondering if there's anybody who would like to, if you'd like to raise your hand, there's a raising your hand feature. You can raise your hand and we might be able to come to you, and you can just either ask a question or make a comment. And I'm going to ask everybody to be very brief. So please do that, and we'll try and come to you. I'm just wondering if while we're doing that, if there's any panelists who know anything about COVID and pregnancy. That was one question, and we may not, and if not, we can find out. And the other is, there was a question around wondering if the impact in low-income countries is likely to be less because there's fewer older people. Maybe Ruairi, I don't know if you have any insight on that.
It's
yes.
no problem.
Yes, Nadine. You know, the demography is different, and maybe just the expectations around what the health services can deliver is different. I mean, many of the countries that we work in a way, have experienced the impact of a disease, an infection, which over a longer period of time has had a greater impact than perhaps COVID will, and that's HIV. And it was a very unnatural infection, the impact on young adults, whereas the COVID is largely going to impact on the health of older people. It also, I think, as I said, I think the impact will be very, very, very rapid, because it'll be difficult to introduce testing on a very wide scale in resource poor countries.
Yeah.
And maybe just one additional factor, but we don't really know how important this might be, but just picking up on what Diarmuid was saying there, in terms of treatments that might have some mitigating effect, both antiretrovirals, I believe, have been suggested as possibly having a mitigating effect, and antimalarials. Right. So I think there's probably quite a lot to be learnt. Because there are so few resources, I don't think we're going to see as much of the painful decisions around prioritization and rationing. You know, rationing would become a real issue in European countries and in North America around who gets those ventilators if the epidemic goes beyond the surge capacity of the health system. I don't think those are going to be questions in the same way in a country that might have 20 ventilators for a population of 20 million people.
Right. Yeah, thank you, Ruairi. And I think, Anne Matthews, thank you. You're just saying there are new good guidelines on pregnancy, which we will then put up on our website. And thank you for that. And I just noticed there's a message in from Ashley Scott in South Africa, just saying that they've acted very quickly within the last week in terms of social distancing. But with that quick response became panic. It came panic, and that's causing a lot of stigma and discrimination, people being refused transport because they're coughing. I think it's a very good point. How do we keep people informed with good and accurate information without having people avoiding testing and treatment due to stigma and discrimination? And I think for me that also speaks to self-stigma, where we know that if you are stigmatizing yourself, you feel very fearful, or you feel like you're going to be judged, and you might try to hide what's going on. So I think keeping the conversation open, and I think one thing I'm noticing in Ireland is that it's a very open conversation. Everybody is talking about getting testing, and I think the contact tracing is really helping with that, because it's just a systematic contact tracing being carried out. Diarmuid, I don't know if you want to say anything. You were talking a little bit there and you got cut off, just in terms of how, for instance, Irish could support Malawi. I think you were saying that you're okay in terms of your kind of sourcing the test kits and the protective gear.
Yeah, and I think this, the early rapid stuff, which is of course going to, as Ruairi was saying, that's the step where it might help, because one can expect that this is going to be a high peak wave coming through quickly, and so what also with regard to what we can benefit from Ireland is actually learning from Ireland, and I keep in touch with the HSE guys. I'm on your the globalhealth.ie website, which is very, very useful. And in touch with basically some of our other embassies, just learning from what's going on in the other countries. So, but with regard to money, and that's not the big issue at the moment, because the amount of money that's needed is huge amounts of money, which should have been here last year, and it has built up the whole system.
Right.
Yeah, so.
Yeah, thank you, Diarmuid. I'm just noticing a number of the questions and comments are just coming in around mental health, the psychological impact of people, not just in terms of loss, in terms of losing people, but also in terms of being kept, being at home, being isolated, looking at the potential rise in abuse, and just, tensions rising, and just somebody asking, how do we prepare for that, and what can we do about that? Niall, over to you. So you just wanted to get in there?
Yeah, I just want to stress how important communication is. In developing country terms, we refer to behavior change communication. And I think that it's really, really, really important. I think key for a lot of us in this is people like behavioral psychologists, anthropologists, people who are engaged in social marketing. They're all really important. It's important also to avoid a panic. And like you just mentioned there, in terms of mental health, we don't want people to have anxiety or mental stress issues.
No.
If we have a message that is very fearful. We want to give a message that enables people to have control over their own health protection. And I think I cannot stress it enough that this is so important in terms of how we communicate these health messages in order to promote health. We promote health through education. And you can see how many people in Ireland have adopted those behaviours, but there are some groups of people who maybe have not necessarily. And the messages that were coming out yesterday, I think from Tony Houlihan, the head in the HSE, was trying to appeal to younger people, not so much to protect themselves, but how they can protect their loved ones, such as their grandparents. And I think in all settings, it is really, really important that we communicate effectively. And clearly there's going to be some element of how we promote health through the enforcement of legislation or laws. We can see it in Italy. You can't move around unless you have a piece of paper. I don't know if we're going to get to that stage yet in Ireland, but I know the police have been ramping up. And that is another way in which we promote health, but it's probably not the way that we want to promote health in the best way. And we don't want to create fear.
No, and I think, you know, that fear, you know, I work a lot with people around their thoughts and their thinking. And I think that, you know, there's the virus, and then there is the virus of fear that is spread, you know, that's spread in our minds. It's spread in the way we use language. You know, I've seen a couple of things like war on COVID and those kind of things. And we learned a lot about that kind of language with HIV. And I think just making sure that even individually, you know, each of us are, you know, we have a responsibility and an opportunity, in fact, to really not spread fear, not spread the virus of fear. I know we have David Weekliam with us, and if we could make David a panelist, I would love to just speak to him briefly. David, as most of you will know, is the lead for global health in the HSE. And he's obviously been very busy and deployed very well there. David, hi, how are you? Can you hear us okay?
Yeah, can you hear me?
Yeah, we can hear you.
Thanks, David.
Hi, everyone. Hi.
So maybe, David, just to kind of give you the floor, really, in terms of, you've heard from Diarmuid and Ruairi, and we've brought in some questions, and Niall, and we'd just love to hear your perspective, anything you would like us to hear in terms of your thoughts on global health. We know that you're in the, you know, you're dealing with a lot in terms of Ireland at the moment, but also connecting with our other country partners in Mozambique and other countries. So over to you.
Yeah, thanks, Nadine, and thanks, everyone. I've not heard all of the discussion. I've had to kind of dip in and out. My phone is kind of ringing frequently, so I've missed the various bits, and maybe just a few reflections, just maybe to what I adjust my camera here. That from an Irish point of view, I think the points have been very well made, and I appreciate the description of the approach that we need here. And I think Niall's points about in relation to hygiene, etc., really critical. I mean, I think if we go think about it at the most basic level, that the way to control the spread is if people who have it are separated from the people who don't have it. And so to me, there's the actions around this. It's mainly social distancing, and it's the hygiene measures that we've heard. And so there you might say that's 2 actions. Actually in Ireland, that's 10 million actions, because that's 5 million people doing the 2 actions. And I think the key to this is that this is something that will work if it's implemented 100%. Other countries take an enforcement approach. Maybe we've not gone down that route to that extent here, but this is what we need, a whole of population response to this. And I think if we can convey across all of society that this is something that's in all of our hands, then I think this is the key, and suppression is still possible. I mean, with regard to low-income countries, I mean, I would go along with what I've heard others say about the likely development there, and I think whatever challenges we face in Ireland, then you can obviously add to that with countries with less resources. And I think that Diarmuid made the point about leadership, and I think our experience with previous situations comparable to this is that leadership at the highest level in countries is a very, very key determinant of how well countries respond. Yeah. We saw that with the HIV epidemic. We've seen it in other situations as well. So I think that at this stage, having that strong leadership before this takes hold in countries is hopefully something that will have some kind of good effect in the longer term. And I mean, then just conscious of resource limitations, it's remembering for these countries what can be done without requiring huge amounts of resources. Mm-hmm. And when you have limited resources, what do you use those resources for? So I think the population health measures like social distancing and good hygiene, these are things that we can all do. So I think very, very good public education is going to be key at this point. And there's a lot of talk at the moment about testing. And yes, if countries can test, it does help a lot in terms of drawing attention to the presence of the infection and galvanizing action. It's not going to be feasible, I expect, in many countries to do the kind of scale of testing you want. But I think testing is something that is part of the response, and one of the measures that I think countries should be looking to do to scale up, really to help them get a hold of managing the response, because without information, it can be harder to take strong action. So I think they're just maybe the few things I'd say just from the top of my head, just after coming in at this point.
Okay, great. Thank you, David. Thanks for coming in. So I think we're coming to the end of what we can do in this hour. We want to make sure that this is something that we are able to offer every week, just as this is unfolding. I think, all of us are in the same boat in terms of, we're just doing the best we can to keep on top of the best information and respond in the way that we can. I see that people are asking on the webinar, on the questions, what can we do? What can Irish NGOs do? How can we support? So maybe just one very last quick comment from each of the panelists, and then back to Hala, but we'll need to finish up. So Niall, if we could start with you.
I just want to highlight, because I know there are WASH people online and listening to this, just to highlight that we have compiled a number of resources through the Global WASH Cluster, and they provide the materials from SPHERE, the Interagency Standing Committee, UNICEF, WHO, and others, including stuff on environmental health, essential environmental health standards in healthcare facilities from WHO in 2008. So I just wanted to highlight that those resources are already out there, and we in the Irish Global Health Network can act as a repository for those resources.
And we're really, really open and willing. If people have requests, please ask us what you need, ask us questions. We will continue to update on that frequently asked questions and respond in any way we can. Diarmuid from Malawi, any last words? I'm asking you to be very brief, and thank you for that.
Yeah, there are a lot of Irish NGOs who are super capable, and what they should be doing, what the guys are doing here in Malawi, is repurposing, doing exactly what Niall's talking about: communication, washing your hands. That's it. Thank you very much.
Thank you, Diarmuid, and thank you so much for joining us. Ruairi, how about you? Just a last word, anything to offer?
Father Michael Kelly calls education the vaccine against HIV, and I think the vaccine before we have a vaccine is accurate information.
Social vaccine. I love the way he says
social vaccine. Yeah. I would like to say something we haven't talked about, but anxiety. I think I feel it on a personal level.
Yes.
Trying to balance, work, a child, not putting elderly parents-in-law in danger, and the professional anxiety. Am I doing enough? There are my colleagues like David out there, at the coalface. And I think we all just need to be kind to ourselves and kind to others. This is very stressful. And maybe just as a final, it's not quite humorous, it is quite serious.
Humor is loud as well, just to know we're allowed to laugh. We should laugh, good, yeah.
If somebody wants to do a count of the speakers, how many times they touch their faces, tweak their ears, their chins. I think Niall and I are sort of up there. I don't know who.
I'm the worst.
Count.
I'm the worst.
Mainly your ears, Niall, you went for, whereas I.
Ruairi,
maybe better than us.
Good, I love that. Thank you, Ruairi. And David, any last words before I don't touch my face? Yes. David, you're muted at the moment. Somebody needs to unmute him.
Yes, Ellen, can you say?
Yeah.
Yeah, no, I think I've only just come in at the end, so they probably were my last words for now. But I look forward. But let's keep the discussions going. I think this exchange I found has been very, very useful, and I think, like Ruairi talked about, the anxiety, we can be supporting each other. I think this is a very useful forum for doing that.
Yeah.
This is a place where the global health community in Ireland and beyond can come together. So let's use the opportunity and let us know between each other what our needs are. How can we support each other? And I think, Nadine, you and your team, you're doing a fantastic job with information.
Yeah.
Let's hear from people what kind of information is useful to people as something that will support them, because that will also help with anxiety levels if we feel there's those supports around us. So
yeah,
thanks for that.
Good, thanks, David. And I think just in terms of, you're right, Rory, what more can we do? And I think the HSE put out a call looking for healthcare workers, health professionals and social care, people in social care offering to sign up and offer their services. And there's a link on our website, on our COVID-19 page for that, which is just something practical people can do. So good. Hala, back to you.
Okay, thank you everyone for this really informative session. I guess everyone really got some clarity today. So thank you for the speakers. Thank you, Nadine, and thank you for our attendees. Ellen, can you put the slide, please? So we are going to continue, as we mentioned, we are going to continue on these webinars every Friday at 1 p.m. GMT or Irish time. And for any questions, and if you have any topics you want to suggest, please send us to our email info@ester.ie. And we have, as we mentioned, there is a dedicated webpage for coronavirus frequently asked questions. We will add the questions that you have asked and we didn't have a chance to answer them there, and also more questions that will be added there frequently. And this recording of the webinar will be available on our website, www.globalhealth.ie and www.ester.eu. By this, we wrap the webinar. So thank you, everyone, and we are looking forward to hear from you. And thank you.
Thank you, everybody.
Hey, everyone.
Stay well.
Thank you very much. Bye-bye.
Bye.
Bye. See you.